It's always great to travel, but travelling with a purpose is so much better. And that's exactly why House of Medics went to Ghana.
You've been kept down for much too long. Stand up, please, and say I am free. Don't forget you are welcome home, welcome home. Come with me on this happy trip back to the promised land. All will be happy and gay.
We have events lined up all over Ghana, and the first stop was Accra, the capital city. Hi. We're really passionate about fostering innovation and advancement within healthcare. So today is our first event in the House of Medics 2024 outreach. We're holding a conference titled MedAdvance, the Future of Healthcare. It's basically going to be a discussion, a conference, a gathering of thought leaders and experts to speak about what we want to see happening in the African continent in terms of healthcare.
You and I, we know that Ghana don't have a lot of money. It's not okay we are surviving. But then how do we make sure that our services are cost effective? Because if you don't have abundant research, then you have to make sure that your efforts are targeted, right? So that you hit the nail on the head with your intervention.
This is Dr. Regan Apong. He gave a really inspiring talk about the role of research in advancing healthcare in Ghana.
Okay, and so we believe that with that we can be able to advance healthcare with relevant research. Thank you very much.
My name is Joel Abuaji.
And my name is Gloria Begonia Igami, and we are students of the University of Ghana Medical School, and as co-founders, we present to you the CLITH project in collaboration with the Touch of Hope Foundation and the University of Ghana Medical Students Association.
They educated us on the rise of children and teenagers drowning in Ghana and how important it is for us to address it.
And from this research and discovery, we will come up with what we bring approach to that.
John Ayer introduced us to his really cool company called Dr. Dogood. This is a platform that helps Ghanaians access healthcare professionals more easily using technology.
But this is a different problem. It's a problem of death. In how stationary is the healthcare? What is the quality of healthcare? How do you think hospitals to the advocate?
HealthFlux is an organisation that aims to improve surgical outcomes in Ghana using innovative techniques like laparoscopic surgery and laser, and Dr. Brown told us all about their amazing work in his presentation. So I've been doing outreach and charity work in terms of donations, free health screening in Ghana since 2012, so I'm very much aware of the challenges that we have in terms of the healthcare system and the welfare system in Ghana. And of course we're still going to do stuff like that, but I think it was just really important for us to figure out how do we actually create a platform for those who are doing things that will change the healthcare system in the future, and how do we foster that kind of collaboration and inspiration, innovation. So that was the thinking behind this event. It's quite different to the other things that we've done every time we've been in Ghana, and that's probably why I'm so excited about it. I think that this is going to be the first of many. It should be an annual thing, just to bring people together to be able to discuss all the amazing things that are going on, and then they can collaborate and actually really change this country for the better.
Thank you so much for that wonderful introduction. And I like to say these are my rules for my patients, my 5 rules. But really they are my 5 wish rules because they never do what I tell them. And these are the things that I tell them when they come to me as a new patient. And I say to them, listen, I don't want you to go home and make any decisions about what we're treating without me.
My favourite talk of the whole event was by Dr. Yvette Appiah. She's a dermatologist that I look up to and I respect so much. She's been qualified for so many years and has her own practice in America. She talked about the importance of the doctor-patient relationship and how to prioritise patient care.
I also don't want them to wait till the last minute. You know, you'll have a patient who has a lesion for me in my practice, or who has an infection group. And Monday they had it, Tuesday they had it, Wednesday they had it, Thursday they had it, getting worse by the way, And then Friday evening at 4:45, they want to call you and say, I'm having this little problem and I don't think it's going to go away. And I'm like, well, what made you think it was going to go away in the first place? He's like, I don't know, it was growing, but I thought it would stop growing. How? So I try to tell them, when you first have a problem, the earlier you come in, the better. Because of course we all know that early intervention works and it saves us a lot of money, time, and makes patients, well, more healthy as they go on.
We are making deliberate effort to reduce the number of undergraduates so that we shore up the numbers for postgraduate training. Because our ratio of postgraduate to undergraduate is quite low, and the vision of the university is to become a research-intensive university.
This is the Provost of the University of Ghana, Professor Alfred Wilson. We were so honoured that he graced our event, and we were even able to go to his office to interview him about education in Ghana and what he sees for the future.
I'm here this evening and very glad to see so many of you, budding health professionals and health professionals, doctors, medical students, nursing students, pharmacists, others. I just want to highlight that some of our challenges are due to some characteristics. We are going through a transition. We are going through a demographic transition, we are going through an epidemiological transition, and we are going through a sociological transition.
Hearing Professor Wilson speak was so inspiring and left us all with a lot of hope, understanding that through research and innovation we can all create the kind of healthcare system that we believe Ghana needs, and it is attainable. Overall, this event went far beyond our expectations. We had over 200 people in attendance, including doctors, medical students, dentists, nurses, and the whole crowd was engaged throughout. The event brought in experts from all different aspects of healthcare and managed to bring in all these different concepts so that we can bridge the gap and improve healthcare for everyone in Ghana. We were privileged enough to sit down with Professor Wilson, and he told us a bit more about his vision for the University of Ghana in the field of research and how that will change the landscape.
We have tried to generate interest amongst our students to conduct research, and we have very experienced senior researchers in almost all the universities across the country. What we really need is that collaboration, partnership, both locally and externally, and also with the national governmental support. We think if we did that, it will help us. We should see research as part of the national developmental agenda. Much as we want to spend money on other things, we think we should spend money on research in all areas, not only in health, in social policy, in gender, as you mentioned, development, climate change, environment. Now our huge environmental challenges and threats to our water bodies, all that we need to be able to look at the next few years. Where do we want to go to? So research in the sciences, in the social sciences are very, very important that we look at.
Okay, so we're currently at the airport. We're about to get a flight to Tamale, which is right up in the north of Ghana. I've never been to the north of Ghana before, so I'm super looking forward to it. Let me explain why we went all the way to Tamale in the first place. It all started with this very moment. In June, we were invited to the Imperial College Black Graduates Careers Conference. This is an annual event that brings together different organisations from different industries and introduces them to students across London, particularly black students, to widen access to these industries. Whilst we were at our stall, we met Cynthia Awoni. She is currently doing a visiting PhD studentship at Imperial College, and she's also part of the faculty of Tamale Technical University. When we get there, we've got a meeting with a few of the key leaders at Tamale Technical University, where they teach a lot of different allied healthcare subjects. And then the plan is tomorrow we're going to be conducting free health screening for the community. This is Dr. Malik. He's a highly respected physician in Tamale and the head of nutrition and dietetics at the Tamale Technical University. He was such a key contact for us. He really helped us get around and was so instrumental in organising the health screening. Our visit also coincided with their annual health week, which was great because we had a lot of different volunteers and a huge crowd.
So I got this opportunity to do a visiting PhD studentship at Imperial College, And based on that, I met the House of Medics.
We started off the event with a launch where we heard from different members of the university faculty, all speaking about why the screening was necessary. We screened for obesity, we checked waist circumference and biometrics, we also looked for high blood pressure, anemia and hepatitis B, and then every single person that attended had a one-to-one consultation with a doctor and a dietitian to speak about their results. This was really impactful. We actually diagnosed some cases of unidentified hepatitis B, and some people even needed urgent admission to hospital because their blood pressure was so high they were at significant risk of having a stroke. Having things like your blood pressure checked can seem so basic if you're in the UK, but our health screenings provide life-saving care to people who otherwise don't have access to free medical attention. After the screening, we actually went around to see Tamale. It's such a beautiful and vibrant city with lots of trade and beautiful buildings, and also lots of green spaces. The next day, we held educational lectures to address the most pertinent issues that we noticed.
30 minutes of intensive exercise. If you are walking and you want the walking to amount to exercise, then it must be brisk walking. Intentional, you are walking and going everywhere.
Looking at the data from the screening, there's obviously a high prevalence of high blood pressure, obesity and diabetes, so we held some lectures to educate the community about how to prevent these conditions. I was also asked to speak about skin bleaching because this is a really common practice amongst women in Tamale. The audience was so engaged, asking lots of questions and really keen to learn more about their health and improve. All too soon it was time to head back to Accra, where we managed to squeeze in one more stop to visit the world-famous red clay, an art exhibition by Dr. Ibrahim Mahama. And we also received some words of wisdom from Cynthia.
There will be collaboration amongst lecturers to do research, to be able to come out with workable and practical solutions to the world problems. So I'm envisaging that kind of environment for my school.
On our way to Sogakope That's how you say it. Yes, it is. On our way to Sogakope for our Female Empowerment Day. Say hi, Natasha. Mom, say hi. Say hi. Nana, say hi.
Hi. I'm the one on camera.
Sogakope is a town in the Volta region, famous for being close to the Volta Lake, which is the largest man-made lake in the world. This is a thriving city well known for fish farming and agriculture. We were invited by CLITH Ghana to hold a Female Empowerment Day at Tamale Technical Institute. This is an all-girls school that teaches vocational and technical skills.
Yeah, so I'm one of the co-founders of CLITH. CLITH basically stands for Changing Lives Through Health.
CLITH Ghana held a session on personal and hand hygiene, demonstrating to the girls proper hand washing technique and emphasizing the importance of keeping your hands clean. This was followed by Dr. Kweku, a maxillofacial surgeon, who taught us the importance of dental hygiene. The next talk was very popular, the girls were very engaged. This was held by Touch of Hope and they taught all things sexual health. This was so empowering for the girls, they were able to openly ask questions and debunk myths surrounding sex. The whole Touch of Hope team was so engaging and they really created a safe environment for the girls to ask their questions and learn more. We felt it was really important to hold this session because with knowledge, the girls can protect themselves.
When we are coming to school, when your mother needs your diagnostics, it's not that small in charge. And you have to manage it. And make sure you go to the dining hall. And make sure you eat. In fact, to the point where I decided that...
And the whole day was rounded off with an amazing charge by Pastor Esinam, who used her own personal life stories to empower the girls and teach them the importance of self-worth.
We don't want you worrying about small things like sanitary pads, something that a lot of people take for granted. So
now, the most impactful part of the day was the opening of a sanitary pad bank, coordinated by all three organisations, House of Medics, Touch of Hope and CLITH Ghana. This will act as a permanent bank within the school for menstrual health products so that the girls can have access to things to keep them clean and not have to worry about that whilst they're studying. And we couldn't leave Sogakope without visiting a local fish farm so that we can see how it's all done. Kwawu is in the eastern region of Ghana and is famous for its beautiful mountains and lush green landscapes. It's rich in culture and customs and has a really welcoming community. Both my parents are from Kwawu, and this is actually a very special place for me because this is where I first started doing any form of giving back in 2012. But after all the shopping, I ended up spending some of the money because I didn't want to just give them money itself because it's quite difficult to track your contribution that way. So I thought I'd spend some of it and then give some of it to them in cash. And we got them some biscuits and Obama biscuits. Check that out. So this is Reverend Yuboa, and he's the director of the orphanage, and he's just going to tell us a bit about it.
Yeah, this home is called Bless the Children International Home.
Whilst I was a medical student, I founded an organisation called Friday Born Designs. The purpose of this was to raise money for this orphanage and to support them with their daily needs. This year, the majority of the money went towards a water tank. Over the years, I would visit the orphanage and donate food, personal care items, and support them with projects such as improving their water care system or setting up an IT school for the children. Last year, the majority of the donation money went towards buying a water tank because they were having lots of problems with regards to the water supply in the area. We've held Christmas parties, dancing competitions and educational events for the children and for children in the wider community. After we founded House of Medics, the responsibility for taking care of the orphanage moved from Friday Born Designs to the House of Medics, and the work continues. Okay, so on behalf of House of Medics, we just want to present this small token for the orphanage.
And we are praying that you continue. God will do something to help you.
Sadly, Reverend Yuboa passed away a few months before we arrived in Ghana this year. This is the place that forever spurred up the spirit of philanthropy in me back in 2012, so it's a place that's very, very dear to my heart. I'm so happy that I was able to encounter Reverend Yuboa over the years, and I learned a lot about how important it is to make yourself available, to look after others, and to help those in need.
For our father who has passed away, he was a very good man who raised a lot of us. For me, he raised me since I was in class 1, and then now I completed university.
I had almost a boy and a chepa. Our Mugusu boy, I had this mobile shame one. The Dika, the Asadani, I Mamma said, Nakopoma or Moonfie, and your baby.
I remember hearing one scripture when I visited the orphanage one year, and it's something like, giving to the poor is like giving a loan to God, and God always pays back in full. I always keep that scripture in my heart, and remember that House of Medics and Friday Born Designs and any other organisation that may come in the future will be based on giving back to the needy.
See, I'm an overcomer. I said, yes, ready, yes, ready.
Overall, I hope this documentary sends a message of hope. And I hope you're inspired that lots of small acts of kindness and taking accountability for your community can make a huge difference. We achieved more than we ever imagined and made so many important connections that we know we can leverage to help even more people in the future. Thank you to Touch of Hope, the University of Ghana, Tamale Technical Institute, CLITH Ghana, the British Council, and Bless the Children International Home. This may have been my 25th or maybe even 30th time visiting Ghana, and it was without a doubt the best visit ever. Ghana, thank you for your hospitality. Until next time.